Okay, hi guys, good evening, all of you. So, we are going to discuss a few more drugs, in fact, one drug in particular today. So, anyone has any idea what topic it is? Which specialty of ophthalmology we're going to talk about with respect to this new drug? Any guesses, anyone? Okay, so we're going to start talking about this new drug which has been FDA approved in May 2025. So it's a very, very recent drug. So it's got something to do with today's quiz as well. So what is the topic you think? Any ideas about the topic? So it is a recently FDA approved drug for dry eye. Okay, and it's a very novel drug. I don't think you've heard of this receptor or this concept at all. So first, there's a new concept in cornea. Okay, so this is basically a drug which is going to increase the tear production by neuromodulation. Okay, it's a neuromodulatory drug. So which nerve is it going to stimulate? It's going to stimulate the corneal nerves, the corneal sensory nerves. Yeah. So the concept is there are some thermoreceptors on the cornea. So thermoreceptors are going to respond to temperature differences. See, like when you are in a cold environment, there is dryness that is there, but after that you start tearing up. Yes, so this is all because of this thermoreceptor. So there is a thermoreceptor called as TRPM8. Okay, TRPM8. It's got a very, very peculiar name. It's quite difficult for you to probably remember. So it's called transient response TRP, transient response potential melastatin 8. Okay, so TRPM8. So that is what it is. So TRPM8 is this receptor that I'm talking about. So this new drug is a TRPM8 agonist. So what does this TRPM8 do? So this TRPM8 is a thermoreceptor on the corneal sensory nerves. Yes. So what is its role? Whenever there is a decrease in temperature, how will there be a decrease in temperature? See, when there is evaporation of water, the temperature decreases. We've got tear film and that middle aqueous layer. It prevents evaporation, but nevertheless, when you keep your eyes open, what happens? There is evaporation and there is a decrease in temperature of around 0.5 to 2 degrees Celsius. So I'm still talking about the mechanism of this new receptor before talking about the drug itself, because nobody has any idea about this receptor or the presence of this receptors in the cornea. Okay, so when in the in between blink or inter-blink interval, the temperature drops. So this receptor picks up, this thermoreceptor called TRPM8. What is TRPM8? Transient T response R. Oh, did I say receptor pehle? Okay, response potential melastatin. Okay, so this receptor, what it is going to do? It is going to stimulate the or pass your action potentials are going to happen in the trigeminal nerve. Okay, so trigeminal nerve also carries parasympathetic afferents. So it goes up, and now the parasympathetically innervated your accessory lacrimal gland, then your meibomian gland and mucin secreting goblet cells. These are activated and all of them are going to secrete tears. So the basal secretion would be increased. Okay, so now this new drug is going to act as this receptor's agonist. Which receptor? This funny name, this TRPM8. TRP we know because we know the TRP ratings that we know for all the programs. Okay, so TRPM8 receptor agonist. So it goes and binds to this receptor and does the same thing. So the moment this drug, I'll tell the name of the drug at the end. Okay, so the drug, when it binds to the receptor, what happens is there is a cooling sensation. The temperature drops and this pathway, or what we call TPP, the trigeminal parasympathetic pathway, is stimulated, and now the parasympathetically innervated, which three structures? Your accessory lacrimal glands, your meibomian gland and the mucin. Basically all three layers of the tear film, the gland secreting all three layers of the tear film, they're activated and they're going to secrete, increasing the basal secretion of tears. So this is a new drug that was recently approved by FDA in May 2025, and it is called Acoltremon. So you all know Pokemon. So this is Acoltremon. Okay, ACOLTREMON. Acoltremon is a TRPM8 receptor agonist. So it is a neuromodulator. And what is the dosing of this drug? See, this drug you can give BD dosing. Okay, BD dosing, and it comes as a single use units. And one second, let me just take a look at your doubts. Before that, those of you who joined in late, so today we're going to talk about this new drug for dry eye, and the name of the drug is called as Acoltremon. Remember the Pokemon and Acoltremon, right? And this is the trade name. It's called Triptry. So I remember as tryptophan. I mean not Triptry, tryptophan tyrosine. So maybe I think in the chemical nature there's tryptophan and tyrosine, but that's how I'm going to remember it, because sometimes examiners, they just forget the name because it's Acoltremon is very, very tedious to remember. But tryptophan tyrosine, Triptyr is easier to remember. So probably they can give that as the brand name. They're not supposed to give, but sometimes it does happen that they give that in the question. So INICET is coming. So that is important. Alright, so it's a neuromodulator, and as I said, this TRMP8 receptor agonist. Yeah. So it stimulates the TPP, that is, it acts via the trigeminal parasympathetic pathway, resulting in increased basal secretion of tears. Yes. And so that is a dosage. Now what about the most common side effect of this drug? See, because it causes that cooling sensation. It's like when you put a menthol, when you eat menthol, or you feel menthol, what do you get? Some people feel it as a burning sensation. Yes, so same way, this one, most common side effect is a burning or a stinging sensation, although it's just transient, not much, unless you're a very finicky patient. And what is the other one I want to tell you? What about people wearing contact lens? Can they use it or not? Yes, they can use it, but remove the contact lens, put the drops, because contact lens patients are very prone to dry eye, and this is one drug which is going to increase the tear production. There's one more drug, we'll talk about it in another session. So this one, you take out the contact lens, instill the drop, and the patient can reapply the contact lens after 15 to 20 minutes. Yeah. Alright, so that is the new drug. So there is a question in your Telegram quiz today based on this drug as well. When do I use Timolol? Who uses scopolamine for glaucoma treatment? Guy, bacha, and epinephrine for glaucoma. It's a very theoretical question you're talking about. So it's same MOA as scopolamine essentially. Which one? Guys, scopolamine is a parasympathetic pathway, and that we are not putting in eye drop. Na? We're not using it as an eye drop. Theoretically, yes, but practically we don't use it. Okay. So any other doubts? So this is a new drug. So again, the name of the drug, Acoltremon, and Acoltremon is... Watch the anti-glaucoma drugs in the EyeMentor app, beta, whoever it is. I've explained everything. You have to know not 4 drugs, you have to know all the drugs. Okay, or anti-glaucoma drugs are very, very important, and today is not anti-glaucoma drug topic. Okay, so any other thing that you wanted to ask? So there's one more drug, in fact, a few more drugs that I will discuss in the next session. Okay, so see you guys. I hope this was useful. This is going to be very useful for your INICET exam, because INICET you get all these outlier kind of questions. Okay, so all the best. So see you at 9 with a quiz discussion. All right, see you guys.